Good evening, I'm Sarah Adams. Thanks for tuning in to CMU Public Television. Tonight, we ask the specialists. Coming up next. Good evening. Thanks so much for tuning in tonight to CMU Public Television. I'm Sarah Adams here with some very special guests here on our Ask the Specialist series. Thanks for tuning in. As always, we encourage you to ask your questions of our guests tonight, our two doctors, by calling our phone number toll-free 1-800-727-9268. You can tweet us at WCMU_AskThe, or visit our Facebook page, facebook.com/askthespecialists. Without further delay, let's introduce our guests that are here this evening. Thanks so much for being here, the both of you.
Thank you.
Dr. Tessa Dake, MD. You are family medicine physician with McLaren, Central Michigan. Thanks for being here.
Thank you for having me.
And what types of questions can our viewers ask of you tonight?
So usually I take care of all ages, all the way from birth to death. So I take care of men, women, children. So general questions that apply to the doctor you would ask about rashes, colds, all those kinds of things you can ask me.
Wonderful. And Dr. Ben Dabalak, orthopedic surgeon, also from McLaren, Central Michigan. Dr. Dabalak, thanks so much for being here tonight.
Thank you for having me.
Tell me about the types of questions that our viewers can ask of you tonight.
Well, they can ask a wide array of orthopedic questions, from bone and joint pain or discomfort or injuries. I've done extra training in sports medicine, so if any of the viewers have questions about sports-related activities or injuries, so.
Wonderful. Well, you've met our guests this evening. Again, we want to remind you that you, our viewers, can call in and ask your question at 1-800-727-9268. Tweet us at WCMU_AskThe, or post your question on our Facebook page, facebook.com/askthespecialists. We were talking a little bit before the show about some current issues that seem to be on everyone's mind. A lot of different sports going on this time of year. And you talked about how you both get quite a bit of questions from concerned parents. You were talking about parents with concerns about concussions and sports-related injuries on that effect. Tell me the kinds of questions that you get and how you typically respond.
Yeah, so I've had a few parents bring in their kids with concerns, particularly after football games, for either a loss of consciousness on the field where either their child was hit or they fell down and then it took a few seconds to wake up, and they just would like to know, okay, how worrisome is that? What should I do from now on? Can they go back and play? And those are some of the major questions I get.
And you probably, being an orthopedic surgeon, get a lot of similar questions.
Very similar, correct. And we have to treat each patient and athlete individually, because it depends on what their symptoms were, how long they lasted, if this was their first concussion or if they've had others. And then we're also using some neurologic testing that we can use as a baseline and see if they've returned to that for return to play decisions.
Well, we're getting a lot of questions coming in from our viewers. Thank you so much for those questions, folks, and keep the questions coming. Some questions that came in earlier via Twitter. What causes arthritis?
Well, there are multiple types of arthritis. Most people think of arthritis as you age, and that's osteoarthritis, which I'm sure Dr. Dabalak can answer to quite well. There's also rheumatoid arthritis, which is kind of the body's way of attacking joints, which is another form. There's gouty arthritis, which some people know have, family members or friends who complain of gout. And there are also infections that can cause arthritis. So there are lots of different things that cause inflammation in joints, and we just term that generally arthritis.
Do you get a lot of similar questions in your practice about osteoarthritis?
Yes, I see a lot of the osteoarthritis. A lot of times the rheumatologists, special internal medicine doctors treat the inflammatory arthropathies. But the osteoarthritis is the more common, and that's the wear and tear. And that's when the cartilage on the end of the bones, kind of akin to the shiny cartilage on the end of a chicken bone, when that starts wearing away, that's wear and tear, and that's osteoarthritis. And that's similar to kind of tread on a tire. Once that's worn away, there's not really any putting it back, but there's a lot of treatment options that we could discuss for the signs and symptoms of osteoarthritis.
There's some rumors that there are types of cartilage that can be grown in a petri dish. Are these old wives' tales, or is this some new technology that's...
Well, it's fairly new technology, and we can harvest some of the patient's cartilage and grow them. And those are more for smaller focal defects. If you have generalized arthritis, as of right now, we can't replace that. But there is techniques for us to harvest the cartilage and then grow it and then put it back in and fix focal areas of cartilage defects.
Good to know. Who knows what they'll come up with next, right?
Absolutely.
Well, more questions coming in. A caller from Manistee wants to know, is there a cure for diabetes? Does it depend on the type? Can it be managed? When people ask you this question, what do you usually say?
So usually it depends. There are actually two types of diabetes. And so the first of which is type 1. And usually that is one that we don't have a cure for yet, unfortunately. It's seen in younger people. And it's basically a failure of the body to be able to produce insulin. And so the way we have to fix it is to actually give them insulin. The more common type is type 2 diabetes, which most of people have. And I don't know if you know, but there's a lot of talk about the diabetic crisis happening in the United States. And a lot of that has to do with being overweight. It has to do with family history, how we eat, how we exercise or don't exercise, depending. And a lot of times we can actually reverse the diabetes that people accumulate over time by weight loss and increasing activity and cutting back on calories.
Okay. Caller from Mount Pleasant has a question for you, Dr. Debelak. Is there anything to slow the depletion of cartilage? And here's the million-dollar question. Do over-the-counter supplements like glucosamine actually help? Please don't break my heart here.
That's a good question.
That is a great question.
Well, with regards to slowing the progression, unfortunately it is caused by normal wear and tear, and some of it's genetic, so unless you can pick different parents, sometimes it's inevitable that you will get it. And while we don't want you to be sedentary and lead, you know, a lifestyle where you're sitting on a potato or like a couch potato, we do know that if you're starting to develop arthritis, a lot of times repetitive activities such as running may not be the best cardiovascular exercise. Perhaps cycling or swimming or elliptical lower impact exercises could slow the progression of wear and tear arthritis. And then with regards to the glucosamine and chondroitin, I have several patients that swear by it, and anecdotally, you know, it works well. Unfortunately, you know, the evidence is, the jury's still kind of out as far as, you know, whether or not there's truly a benefit. But like I said, several patients swear by it, and so there's not a lot of untoward effects from taking it. So I tell the patients that, you know, it's worth a try, and
can't hurt.
Can't hurt. So.
Okay, works for me.
I also actually get a lot of questions too about, you know, can changing my diet, gluten-free diets, like some people are talking about elimination diets where they progressively remove different types of food from their diet and see if that helps their arthritis. Have you had any success with those?
Not personally yet.
Yeah. Yeah.
Those are interesting. I think some things, people have a lot of really good questions. They probably come to you with a lot of really good questions. But I know too, from personal experience, sometimes there's information out there that leads us down the wrong path.
Yes.
So it's always best to check with your doctor. I'm guessing that's, that's the great way to go. A caller with a question about an itching. All of a sudden it goes from area to area of the body. Why does this happen?
I think I'd probably need a little bit more information.
Okay.
If there's a rash that goes with it or something like that, or if they've been taking new medications, sometimes it can be an allergy, but it really does depend. I'd ask the doctor that they go to normally.
Okay. A caller from Ludington has persistent neck pain, but only during sleeping at night, not during the day. Why does this happen?
Well, that's a good question. I would probably have to see the patient, get a more thorough history, and do a physical examination to know, but it sounds like it's positional, and perhaps trying a different pillow or a different position might aid. And I would want to know too if they're getting any radicular symptoms or any pain going down into their shoulder and arm and that, or if it's isolated to their neck. But it sounds like it's positional in their bed.
Caller from somewhere in northern Michigan wants to know, what does a fatty pancreas mean?
And so, ironically, I had one of these today. So Oftentimes we actually hear more about fatty replacement of the liver, and oftentimes when we gain weight, we normally think of putting fat on the outside of our bodies under the skin layer, but we actually can also deposit fat inside the abdominal cavity. Sometimes that actually goes into different organs, and so you can get fatty replacement of cells both in the pancreas and the liver, etc. And sometimes it can actually impair the function of the organ. So pancreas helps us break down things like fats by helping produce different enzymes that break them down. And so you can actually see patients have abdominal pain or diarrhea and other symptoms from fatty replacement of the pancreas.
Wow, no kidding.
Yeah.
Wow. So weight loss, healthy diet,
yeah,
that will correct it?
That usually can help improve it. Of course, if there was a problem as in they had a pancreatitis or an actual inflammation in the pancreas that initiated that change, it may not be fully reversible, but weight loss absolutely can help.
Okay. Caller from Alpena, this actually applies to both of you. What symptoms occur with stress? I know this can have a lot of symptoms that go across both of your fields of expertise. What kinds of things have you noticed are stress related with the patients that you see?
Well, stress probably affects more of the whole patient and the entire person, and but a lot of times it augments signs and symptoms of underlying disease. And if they have pain, you know, back pain or neck pain or joint pain, a lot of times stress can kind of go hand in hand with depression, and it really kind of augments your physical symptoms and discomfort a lot of times. So stress relief is a good idea, and cardiovascular exercise to help relieve stress will oftentimes alleviate a lot of physical symptoms.
Some other calls coming in. Are migraines triggered by weather changes? That's actually something that is big this time of year with the weather changes and allergies. And what kinds of information would you give to those folks?
Absolutely. So there are some patients whose headaches are triggered by weather changes. Whether or not they're specifically migraines, sometimes it's hard to tell. A lot of people also experience migraines as well as allergies. And so with weather changes, if they have a flare in their allergies, they can get worsening headaches and they can trigger migraines as well. So absolutely, you can see changes in headache patterns based on weather changes.
Dr. Debelak, are you familiar with the symptoms of bone cancer and how it's treated? How does that connect with orthopedic surgeon's role?
Well, I could probably spend more than half an hour on the various bone cancers. First of all, there's two major categories. There's benign and malignant, and even sometimes it's there's aggressive and non-aggressive benign and malignant tumors. But a lot of times if patients present with having a palpable or mass that they can feel on a bone, and then also bone pain.
Yeah.
So if you feel like a bump and it's changing in size or becoming, you know, larger, or becoming painful, or having any redness or warmth, or starts becoming what we call more symptomatic or becoming swollen or painful, then you need to see a physician. And oftentimes you get referred to an orthopedic surgeon.
A caller wondering about the neti pot. Can it clear your nose? Is it helpful? Another thing you probably get a lot of this time of year.
Yeah, I'm actually a really big fan of the neti pot, and I don't know if everyone knows what that is, but basically it's a little pot. It looks like a teapot, and you put water and then a solution of salt in it. It's not hot, it's just room temperature, and then you use it to rinse the nose out and the sinuses. And it's really gross. You don't ever want to see anyone do it, I promise you that.
Okay, good
but
to know.
for many patients, it's worth it. Because it's a salt solution, it can help dry up the mucous membranes inside the nose and the sinuses, and that can give them some relief from their symptoms and the excess mucus that builds up with sinus allergies, or nasal allergies, as sometimes you hear it called on TV. Another good alternative that I tell patients, if they really either they don't like it or they can't afford one, even though they're not too expensive, is you can always do a pot of hot water, put a little salt in it, boil it, and actually stick your head over the pot. Don't burn yourself, and then throw a towel over and take some deep breaths. And it's similar to a steamy shower where it can help clean the nasal passages. But please make sure you have Kleenexes nearby, because you will just rain yuckiness. So good luck.
Okay, good to know. Okay. A caller, someone on Twitter wondering, how long do the current knee replacement knee replacements last. It looks like this person has had a full joint replacement.
Oh, wow.
What is the average these days? I know it's come a long way.
Right, and they have certainly progressed with the technology of the metals and the plastics. And once again, it depends on your activity level, and just like the knee before it, the knees can wear out, and the more that they're tested, the more they can wear out. Ideally, we would like, you know, a knee to last at least 15, 20 years. Sometimes when they need to be revised, it's as easy as, well, I say easy, but as relatively simple as going in and changing the plastic between the two metal surfaces. Sometimes the metal loosens and you have to change the metal on either side of the knee. But a lot of times it's a matter of going in and changing the plastic liner in between that wears. So, but good question.
Yeah.
Facebook question wondering what is the difference between regional and general anesthesia? Pros, cons, this is probably something you both get questions about.
Absolutely. It's probably something you make decisions on pretty regularly.
About regional versus
Regional
general?
versus general. Pros, cons,
Okay.
pain level, that sort of thing.
Well, I assume they mean for surgery.
Yeah.
And so, the nice thing about the regional anesthesia is that we don't necessarily have to have the patient asleep to where they're completely under general anesthesia and they have a tube in their throat to breathe for them. And so you're able to mitigate those risks of general anesthesia. And it's really good for pain control. A lot of times we'll do both to where we can numb up a part of the body and then also do general, and that's good for pain control after. But sometimes, depending on the surgery, you can't have a regional anesthetic, and some people are deathly afraid of needles and don't want regional anesthesia, but that's what regional anesthesia is, when we can numb up an area of the body and not
do effective
and do the correct.
Yeah. I mean, I would say that the one thing that can be a little rough on patients if you do a regional anesthetic is, while they do give you medicine to kind of make you a little sleepy and out of it, that you hear things. I mean, so if you're still there, so people talking, if they're actually cutting things open, those kinds of things, you can sometimes hear things. You usually don't remember though, which is a good thing.
I was going to say, not something that I would really want to experience, so no offense.
But it's a really great option for people who may be older, who have really bad heart disease or lung disease. And so putting them all the way to sleep and having to breathe for them on a machine is maybe a little too risky.
So it's
so
a
that
safer...
way, yeah, so that way it's a safer option for them to still get a surgery they may really need and benefit from without as many risks.
Okay. A caller, a Facebook question. How do you know if a bump on the head is a serious injury? Again, we're talking about this is the time of year for lots of sports, football season. How do you know if something needs to be addressed, a trip to the emergency room versus an ice pack?
Yeah. Well, I think one of the major things we always ask people that say they fell or they got a bump in the head, they were hit in a sport, is, okay, did you pass out? Did you lose consciousness? I think that's kind of a big thing for us. And then the second goes on to say, okay, so how are you feeling now? You know, are you having nausea? Are you having headaches? Do you still feel confused? Those are all signs that maybe you do need to still go to the emergency room, have a further evaluation. The main thing we worry about is whether or not you hit your head hard enough to have a bleed, and that's what we are primarily concerned with.
A question from Cadillac, caller wondering if there are any cures or remedies for gout.
Well, I think either of us. I'm not necessarily sure about cures. There are medicines that help reduce your body's production of the uric acid, which causes the crystals and painful joints. But and then there's anti-inflammatory medicines. So as far as a cure, I'm not sure about cure yet, but there are medicines that would either decrease the inflammation in joints, perhaps caused by the gout or uric acid crystals, or decrease your body's production or increase the excretion of the uric acid.
Absolutely.
Dr. Dake might be
Yeah, absolutely. And then, you know, there are common triggers that patients talk about when they say, oh, I know I'm going to have a gout flare, particularly around Thanksgiving or Christmas, because we tend to eat plentifully, shall we say. So if you're eating a lot of red meat, particularly wines, cheeses, a lot of people find they have uric acid build up with those, and so they do get gout flares. So monitoring what you're eating is always a good way to kind of avoid flares.
Speaking of seasonal type questions, Facebook post wanted to know, what does getting the flu shot prevent? Does it prevent the stomach flu too? Another $1 million question.
Absolutely.
What do you suggest?
So as far as the actual stomach flu, unfortunately, no. It's actually more built around preventing respiratory disease. The hard part is that there are 1,000,001 flu viruses out there, officially called influenza viruses. And basically what we do is we try to predict what is going to be the next big flu virus. We pick one, maybe two each year that we think are going to really cause the majority of illnesses. And then we try to make the flu shot attack those in particular. And so yes, there are people who will say, I got the flu shot and then I got sick and I got it because of the flu shot. Well, unfortunately, it's not a miracle worker. It really only works against the top 1 or 2 viruses that we think are going to happen that season.
Do you still recommend that people get the flu shot?
I do, particularly for very young children and the elderly if they have either illnesses affecting lungs or heart, particularly because those are the people who are going to be most affected by a flu illness. If you're young, you're healthy, and you don't mind staying home a few days and watching a few movies with some Kleenex, then you don't need to.
A caller from Midland wants to know if you could describe the repair of the rotator cuff and the ACL.
Wow.
Not fun procedures, from my experience on my end.
From the patients, no. I enjoy doing rotator cuff and ACL surgery. But the rotator cuff, and there's 4 muscles of the rotator cuff in the shoulder, and that's, it's usually we're talking about the tendon pulling away from the bone that lifts your arm up. And nowadays, I'm able to do a lot of those rotator cuff repairs arthroscopically or through little poke holes, and then through fiber optic camera and instrumentation. We're able to put anchors with suture in them into the bone, put the suture through the tendon, and bring that tendon back down to the bone, and that holds it until your body heals the tendon back.
Isn't that amazing?
And so that's, in essence, the rotator cuff repair. Unfortunately, for ACLs, right now we have to reconstruct. Once you tear your ACL, it doesn't have the good blood supply. It doesn't heal itself necessarily per se. So we have to reconstruct it. And the common ways that we reconstruct that are either with a tendon in the front of your knee, the patellar tendon, your hamstring tendons, or a sterilized cadaver tendon allograft. And so I'm able to reconstruct an ACL with either of those choices. And
what is the typical recovery time? I know it's a lot shorter than it used to be, even in the past 5 years.
Well, for the ACLs, usually in our athletes, we do not let them compete before 6 months. It takes a while for that graft to incorporate into the bone, as well as for the body to start accepting that tissue and turning it into the new ACL. So.
Well, believe it or not, we have just about 4 minutes left, so we'll get to a few more questions before the end of our time here. Dr. Dake, a question for you. How does caffeine affect blood pressure? Or does it? Please tell me now.
Yeah, so everybody's different. You know, you will have some people who drink a ton of caffeine and they are up all night, and you have some people who drink caffeine and it doesn't matter, they could sleep like a baby. Similarly, usually the effect of caffeine is that it will increase blood pressure, but everyone's different. There are people who become immune to certain effects of caffeine, but it may not always be that it stops high blood pressure, but I would make sure that if you have high blood pressure, maybe cutting the caffeine out would be helpful.
Okay. Caller from Houghton Lake wants to know if there's any research with stem cells versus hip replacements.
Well, I think the jury's still out on the stem cell treatment in various areas of medicine, including our orthopedics and cartilage restoration. And so right now it's still in the investigation stage, so we don't have a lot of good peer-reviewed level 1 evidence to support, but certainly that's an ongoing investigation in centers across the country and world.
Facebook post, 38-year-old male, my elbow hurts all the time. I think I might have hurt it exercising or lifting something. It hurts when I bend it for a period of time or extend it. How can I tell if I've ripped a tendon in my elbow, and what can I do with no insurance? A lot of questions in there.
Yeah.
There are a lot of questions in there, and certainly that is definitely one where we'd have to examine clinically and physically to see where his elbow is hurting and test the stability. A lot of times the ligaments are injured, and then sometimes it is muscles and they have a strain or can't extend or flex their elbow. So that one I definitely have to examine and be able to better answer his question.
Caller from Gladwin would like to know, Dr. Dake, what do you think about cayenne pepper mixed with vinegar to drink daily?
It sounds terrible. To be honest with you, I don't want to try it. But if you're brave enough, hey, go for it.
Would there be any benefits to something like that?
Well, there are some alternative therapies that have included cayenne pepper, particularly for inflammation, but I don't know if you were willing to risk your indigestion on it. But I say give it a try. Good luck.
A caller with just about a minute left from Custer, Michigan wants to know if there's anything that can be done for a leaking Baker cyst.
Well, the Baker cyst is usually a cyst in the back of the knee, and the treatment usually is the underlying pathology or disease process in the knee, whether it's arthritis or a torn meniscus, and that Baker cyst is a product of inflammation in the knee, and the fluid goes to the path of least resistance, which is sometimes through the capsule in the back of the knee. So the treatment would be the underlying arthritis or meniscal tear disease in the knee.
Well, believe it or not, that's all the time that we have for this evening. I'd like to thank you both for being here. Dr. Tessa Dake, MD, family medicine physician from McLaren, Central Michigan. Thanks, Dr. Dake. And Dr. Ben Debelak, orthopedic surgeon, Debelak DO, orthopedic surgeon, also from McLaren, Central Michigan. Dr. Debelak, thank you so much for your input this evening.
Thank you for having me. Pleasure.
We'd also like to thank our phone volunteers for taking your questions this evening. There they are. Thank you so much to them for giving of their time this evening. We want to remind you to tune in to visit our Facebook page, facebook.com/askthespecialists, for answers to some of the questions we couldn't get to this evening. Check that page out in just a little bit. Please join us next week for Ask the Small Business Specialists. For all of us here at WCMU, thanks so much for tuning in to Ask the Specialists. I'm Sarah Adams. Have a good night.